Okay, let's talk about something we usually don't, our bladder. For way too long, we've kind of just pushed its little messages to the side, treating them like minor annoyances. But what if they're more than that? In this explainer, we're going to dive into how to actually listen to what our bladders are trying to tell us every single day. I mean, really think about it for a sec. That feeling that you have to go all the time, that sudden gotta go now urgency, maybe that little leak when you laugh really hard, are those just inconveniences? Or is your body trying to send you a much more important signal? Turns out, these are often early warnings that we really can't afford to ignore. And this right here is the big idea. We have to stop thinking about the bladder as just some simple tank that holds liquid. It's so much more complex. It's actually a clinical sentinel. Think of it like a guard on duty, giving you real-time updates on your overall health. Our job is to finally learn its language. Now, it's true. As we get older, things do change a bit. The bladder's tissue, which is super elastic, can get a little less stretchy. But here's the thing, and this is so important. Having really troublesome bladder symptoms is not a normal part of aging. The idea that, I'm just getting older is an excuse, that's a myth we need to bust right now. Okay, so how do we start translating what we're feeling into something that makes sense? Think of this next part as your official decoder ring for understanding the bladder's pretty unique language. This chart is super helpful, so let's walk through it. First up, let's talk about what you might feel. That burning or stinging sensation, doctors call that dysuria, and it's a dead giveaway for irritation, usually from something like a UTI. Then there's the timing of it all. Frequency is when you're going more than, say, 8 times in a 24-hour period. That often means the nerves in the bladder wall are just a little overactive. Urgency is that I have to go right now feeling. That points to involuntary muscle spasms. And finally, what you might see. Any tint of pink, red, or brown in your urine is called hematuria, and it means there's bleeding somewhere. And that super frustrating feeling of incomplete emptying, like you never quite finish, that could be a weak bladder muscle or even some kind of blockage. All right, now that we know the language, here comes the million-dollar question. How do you tell if a signal is just a minor nuisance or a serious red flag? This is where paying attention becomes absolutely critical. Yeah, these signals can mean a whole bunch of different things. They could be pointing to something really common and totally treatable, like a urinary tract infection or a UTI, or maybe bladder stones, or a condition called overactive bladder. In men, it could be an enlarged prostate. But, and this is a big but, they can also be the very first warning sign of something much more serious, like bladder cancer. And this chart, wow, this is exactly why you can't just Google your symptoms and call it a day. I mean, look at this overlap. Painful urination, going all the time, that urgent feeling, even blood in the urine. All of these can be symptoms of both a simple UTI and bladder cancer. The symptoms are so similar, it's impossible for you to know the difference on your own. You have to get a proper diagnosis. Let's just pause on this for a moment because it is that important. Yes, blood in your urine can be caused by other things, like an infection, but it is the #1 most common symptom of bladder cancer. So the bottom line is simple. If you see blood, you see a doctor. Period. It is never normal. And when we talk about things that raise your risk for bladder cancer, there is one that's just head and shoulders above the rest: smoking. It is, without a doubt, the single most important risk factor. Quitting isn't just a good idea, it's the most powerful step you can take to lower that risk. Okay, so let's get real for a minute. What actually happens if we just ignore this stuff? If we just put it off? Well, the consequences can be pretty severe. We're talking about turning a totally treatable issue into a full-blown medical emergency. Let's just take a common UTI, for example. I mean, it's so common, it affects at least half of all women at some point. If you ignore those first signs, the burning, the urgency, that bacteria can literally travel up into your kidneys. Now you've got a much bigger problem. And if that's left untreated, it can lead to sepsis, which is a life-threatening, whole-body infection. You see the path here? It goes from annoying to potentially deadly, all because it wasn't dealt with early. And for cancer? Well, the stakes are just as high, if not higher. I mean, listen to this statistic. It's pretty sobering. Just delaying a bladder cancer diagnosis can increase the risk of dying from it by as much as 34%. Early detection isn't just a slogan. It's literally a matter of life and death. Okay, but look, this isn't all doom and gloom. Not at all. The good news is we are not helpless here. This last part is all about taking action.
We're talking about concrete, practical steps we can all take to listen to those signals and keep our bladders as healthy as they can be.
So let's make this super clear. This is your when to call the doctor, no excuses list. You see blood in your urine? You call. You have pain or burning? You call. You get a fever on top of these other symptoms? You definitely call. If you literally can't pee at all, that's an emergency. And finally, if your symptoms just don't go away or they keep coming back, that's your body telling you to get it checked out.
And if you want to play the long game to keep your bladder healthy for years to come, these 7 habits are basically your playbook. Drink enough water. A good rule of thumb is your urine should be a pale yellow color. Go when you have to go. Every 3 to 4 hours is ideal. Strengthen your support muscles with pelvic floor exercises. And then there's the big lifestyle stuff. Try to limit things that irritate the bladder like caffeine and alcohol. Maintain a healthy weight, avoid constipation, and we have to say it again, if you smoke, please make a plan to quit.
You hear a lot about Kegel exercises, right? But what are they, really? Well, for both men and women, they're all about strengthening that hammock of muscles that basically holds up your bladder. When that pelvic floor is strong, it's a better support system. It gives you more control and helps prevent those leaks when there's pressure, like from a cough or a big laugh. So, let's bring it all home. Your bladder is like this incredibly accurate barometer for your health. It's constantly giving you a forecast, a reading of what's happening inside. The real question is, are you listening? Are you paying attention to that forecast? Because listening to those signals just might save your life. Let's talk about your bladder. It's sending you some really important signals about your health. You know, we all notice these little changes, but do we ever really pay attention to them? Seriously, you should think of your bladder as an early warning system for your overall health. These signals are basically a language, so let's decode what it's trying to say. Okay, so symptoms usually fall into 3 buckets: storage, voiding, and what happens right after. If any of these are happening to you, especially if they're persistent, it's time to talk to your doctor. One of the most critical signals is seeing blood in your urine, which is called hematuria. Let's be really clear here. Blood in your urine is never normal, not even once. Why is this so serious? Well, delaying a bladder cancer diagnosis increases mortality risk by 34%. Hey, it's not just about cancer. A simple bladder infection can become life-threatening. See, that infection can travel up to the kidneys, and suddenly you're in a medical emergency. For women, symptoms often get brushed off as just reoccurring UTIs, hiding bigger problems. And for men, a weak stream could signal prostate issues that can really damage the bladder. So what can you do? Well, you can take some simple steps for a healthier bladder. A few simple things can make a huge difference, and quitting smoking, that's the big one. Okay, and some symptoms are true red flags. If you have any of these, get help immediately. Look, your bladder is sending you messages. The real question is, are you ready to listen?